With raising prices, some people say we're facing a healthcare crisis, locally and throughout the United States. Doctors are getting squeezed due to declining reimbursements for services, costs of technology changes, and increasing costs due to inflation. Healthcare is at risk, some people say, with many healthcare specialties facing shortages and reducing access to quality healthcare for many Americans. Welcome to Forum 360, the show with a global view but a local perspective. And our special guest today, Harry G. Curley, is going to help us to understand the potential stealthy healthcare crisis and some of the tools, the medicine, to make things better. I'm your host, Sally Henning. Welcome to Forum 360, Mr. Curley.
Thanks for having me.
Yeah, a little bit about you for our audience. Mr. Curley is the president and CEO of PRC Medical, a subsidiary of StreamlineMD. It's a Cuyahoga Falls company that has grown from a local to a national client base. A little bit about Mr. Curley. In addition to being the CEO of PRC Medical, he has an interesting background, having been a Wall Street financial mocker.
Investment banker, yeah.
But I think more interesting is your service to this country in the Iraq War.
Yes.
Tank commander.
The Persian Gulf War, to be
Persian
specific.
Gulf War,
yes.
right? Bronze Star.
Yes.
Yeah.
Yep.
So,
I would do it all over again. It was a great experience.
Yeah. Thanks, B. So that certainly gives our audience the reason to believe that you're ready to take on this particular healthcare crisis.
Definitely.
So would you tell us a little bit about it? What is it? Why should people be concerned locally and nationally?
Well, I think to begin, there's a supply and demand issue. There is an increasing demand for healthcare as the baby boomer generation retires and enters that Medicare age.
You're talking about me now.
Correct, yes. And at the same time, the generations that are younger than the boomer generation are smaller in population, and there aren't as many people to replace the boomers as they retire. And therefore, there aren't as many people available to provide health care as there used to be. And so there's this definite supply and demand gap between those that need the care and those that are available to provide the care.
So some people say that doctors are feeling squeezed. Can you
Yes.
talk, is that an accurate description?
Yes, doctors, nurses, all of the care providers. Again, there's a shortage. They're stretched thin for the care that they have to provide. And it's very difficult to find new resources. Our challenges with bringing in immigrants to this country, if there was a way to streamline that process so that we could get healthcare providers as qualified immigrants legally through the doors to enter the country and become care providers, would be fantastic. The other opportunity is to possibly use new technology, new automation, artificial intelligence related type technologies that can allow the providers to become much more efficient and scale for the time that they do have.
So how do the providers deal with treating large numbers of people who have different cultural concerns, different language issues?
That's a great question. There are, it appears to me generally, Spanish-speaking care providers and resources at most hospitals, especially if there is a large component of Hispanic or Spanish people in that community. But most of the areas of the country that do have pockets of different nationalities will have local language speakers there. It may not be the care provider directly, it could be a translator.
So what are the other complications that doctors and other medical providers are encountering?
Well, one of the other challenges for doctors specifically is it is very hard for doctors to get paid in an accurate and timely manner for the services they provide. It is an arduous process.
So why don't they just go into teaching or something?
Well, they do want to see patients, and there are plenty of sick patients that need to be treated. And there are not that many, relatively speaking, skilled providers of care today as we had before, as I mentioned.
But that then becomes the crisis. People,
correct.
The providers can get into something that's more lucrative. So why go to the trouble?
There are some that do that. there are some leaving healthcare to do other entrepreneurial ventures, going back into teaching, et cetera. But there are a lot that are very committed to their Hippocratic oath to continue to provide care to patients. And getting them paid is really challenging. As I mentioned, it's very complicated. And having challenges getting paid in a timely manner from insurance companies and patients is also exacerbated by inflation. As I mentioned, there are a lot of shortages of human resources today. So the cost of finding good people, whether they're doctors or staff, that will come to work in a regular and responsible way is increasingly challenging and costly.
How do you advise people to navigate this? How do you?
My advice is to, for providers of care, to work with or try to find help from experts in the field in various aspects of service. It could be from a technological standpoint. It could be from an alternative care technologies and devices. It could also be from services such as those that are have expertise in medical billing, et cetera, that can help them improve their revenue and manage their overall cost overhead.
Sounds like a minefield.
It is very challenging and it's not getting any easier. Healthcare is becoming increasingly specialized and subspecialized. And for these providers that are looking for service, it is in their best interest to find a partner or vendor that really understands their specialties, the procedures they're performing, and the diseases they're treating in order to be much more effective at providing service.
How do they navigate this system? How do the providers navigate this system for them?
Well, they have industry societies. There's the American Medical Association as probably the largest overarching association. And then there are subspecialty or specialty and subspecialty organizations throughout the country. For our company, PRC Medical and StreamlineMD, we specialize in radiology and interventional radiology specialists across the country. And those organizations have societies known as the Radiology Society of North America, the American College of Radiology, and the Society of Interventional Radiology, for example.
Excuse me, what is interventional radiology?
Well, first, radiology in general is a diagnostic specialty.
Like x-rays or
so
something?
they're looking at images with using very high imaging technology to diagnose disease in the body. An interventional radiologist is a subspecialty of radiology. And these specialists are more like surgeons, but they don't use a scalpel. They don't cut the body.
They zap people.
They go into the body. No, they actually go into the body with tiny catheters that they can deploy all kinds of interesting technology through to treat disease in the body in a very targeted manner without cutting the body open. So increasingly, these services can be provided either in the hospital or outside of the hospital. They're increasingly being developed to perform outside of the hospital, which is a much lower cost environment, and it's much easier on the patient. And in many cases, they can be performed in a doctor's office or surgery center in the same day, and the patient can leave with nothing more than a Band-Aid.
Well, so what are some of the differences in the challenges of getting revenue for those folks versus an ordinary general practitioner?
So the procedures that they perform, both diagnostic and interventional, are very complex. And there are very strict rules on exactly how to document their cases. So the provider has to document their case in a note in a particular format. And then the way that they're actually coded. So for billing purposes, one has to translate the documentation into codes that go on healthcare claims that are filed to insurance companies so that they can adjudicate and pay the claim.
Is the coding mandated by the government? Is that what's required?
Yes, it's generally managed by the AMA, but also endorsed by CMS, the Centers for Medicare and Medicaid, which is the federal government.
So you have to have, Medicare providers have to have people that are up with what the current coding is and what the regulations are?
Yes, the regulations are updated regularly, at least annually, in some ways quarterly. And it's not just government regulations. There are also commercial insurance companies that have their own rule sets.
How often does the coding change by law?
Annually,
So
for the most part.
an individual practitioner has to have people assigned in their office just to keep up with the coding?
Exactly. Well, trained and to assign those codes in a regular and responsible way so that the claims go out the door accurately. Providers can get in trouble for claims that are overstating the services provided and therefore charging more. They can also get in trouble on the other way if they're not being charged enough, if they're not capturing enough. So the aim is to get accurate documentation and coding and claims for every service performed.
How does a small provider keep up with that?
It's getting harder and harder.
Individual doctor's
And there are
office?
fewer and fewer individual providers, especially in primary care or general practice. Today, those that are independent practitioners are typically high-end specialists, like some of these interventional specialists that we discussed. But for the primary care folks, it's gotten exceedingly difficult. They make up over 50% of the physician universe in the United States, and the vast majority of them today are employed by either health systems or large practice organizations.
It does seem like a lot of doctors are joining bigger practices
Yes.
or hospital practices or something.
Yes, it's true, and it continues. It ebbs and flows to some degree based on the economy. In a good economy, you'll find others, providers that'll become more entrepreneurial and strike out on their own. But in tough economies, they'll probably seek some security within an ownership organization like a health system or large practice group.
Let me ask you a terribly unfair question. What do you see as the impact of inflation on all of this?
Inflation has exacerbated the cost side for these providers, so it's not only difficult to find people, once you do find them, they're very expensive. And the cost of skilled labor in these subspecialties of healthcare has gone up more rapidly than the baseline of inflation nationally.
So, with respect to certain specialties, are some specialties more affected by inflation or by all these changes in technology?
I would say that the more specialized, the more dramatic the inflation is. And it gets back to just the supply of the resources these specialists need is very hard to come by. And it's not just human, it could also be in their supplies and devices. COVID created a lot of problems in the supply chains globally. So some of these devices and materials that the providers need to treat disease were very hard to come by and became quite expensive in the process. The inflation obviously has slowed a bit across the country as well as in healthcare, but it's still a problem.
You're tuned into Forum 360. Our special guest today is Harry Curley, the president of PRC. We're talking about what many people are calling a healthcare crisis that's sort of stealthy, but something that people have to deal with. And so we were just talking about this issue with Mr. Curley for Forum 360. I'm Sally Henning. So you're just talking about how inflation and COVID
Yes.
affected. What other things are you saying with respect to how COVID is affecting the delivery of healthcare services?
Well, it's in one way it was it accelerated some technologies and services that are really beneficial for the long term. And the best example is telemedicine or telehealth. So increasingly it is permitted for doctors.
Excuse me, what is telehealth or telemedicine?
Right. It's when a provider's care can communicate with a patient through a video service like a Zoom technology.
Like a Zoom or
but it has to
FaceTime?
be HIPAA compliant.
Okay.
So there are certain
mean,
technologies that
when you
provide
say-
that same type of solution, but that are HIPAA compliant.
So it has to be confidential.
Correct.
Okay.
So the data that is captured in that communication transfer has to be encrypted to a certain degree in order to maintain that privacy standard.
Encrypted so it's secret, so no one else
Correct.
can. So you must be getting into a lot of electronic medical records issues.
Oh, absolutely. I would say that 95% plus of the United States, if I had to guess, is on electronic medical records or electronic health records today. They're effectively the same term used for the same point, which is now the medical records that patients used to have in those volumes of file folders in doctors' offices is now largely in electronic format.
So back to the individual practitioner, they need to be able to have all the technology with respect to coding.
Yep.
But then they also have to have all the technology with respect to billing and files
Correct.
and records.
Yes, and all of this technology is complex and very expensive. And it does a nice job of making certain processes more efficient, but other processes maybe not necessarily so. Perhaps in certain situations, paper was actually a little bit more simple and efficient than the electronic complexity. But the electronic complexity is here to stay, and there are high hopes that automated technologies like artificial intelligence will continue to improve that workflow and efficiency for all the doctors.
There's something very comforting about being able to go to a filing cabinet and just pulling a file on a patient.
Yes.
Versus, let's look it up on the computer as soon as the electric comes
Yes.
back on.
And going to electronics created a whole new set of challenges that didn't exist before with just paper. Nowadays, hacking and cyber attacks are a real threat to the healthcare industry, not just nationally, but globally. There was a massive cyber attack against a very large healthcare technology and service vendor in February of this year that shut down major components of electronic claims submissions of healthcare claims from the doctors and hospitals to insurance companies, and also the pharmacy benefits verification, which is also now done electronically between pharmacies and insurance companies. All of that was shut down, or a large portion of the market was shut down from a single cyber attack that happened to us in February of 2024.
Wow. You're probably still seeing the impact of that.
Yes, and it's not just that particular event. Largely, it's been corrected, but there are still little remnants here and there where problems exist. For example, there are some elements of the claims process that somehow got lost in the ether during that whole process. So things that used to transmit electronically between the insurance company and the provider of healthcare, now vendors like our company have to go into the individual insurance company's website to find pieces, parts of different claims information in order to complete the whole file.
So I think it was Dr. Applebaum, who was one of the people who developed a system for patients' records to be available throughout the hospital for emergency room treatments, and that made it possible for the paper not to be necessary.
Correct. There's still a lot of challenge with electronic health records for the interoperability, as they call it, which is the transmission of health information between providers, between institutions in a secure and reliable manner. That's still a big challenge. It's exceedingly complex, as some electronic health records are very voluminous and contain a tremendous amount of images. And transmitting all of those files through the internet in a rapid and efficient manner is very tricky, and also at the same time trying to keep it secure. So the world right now, especially in the United States, we're still working on these problems. Progress is being made all the time. I'm very optimistic about the long term. But we are going through a squeeze right now that I hope can get resolved in the supply and demand issue, whereby we can free up technologies and human resources to become highly trained and to solve this demand issue by providing a greater amount of supply of humans and technology.
Speaking of human resource challenges, what are the values that you see are necessary to ensure that this healthcare crisis is handled appropriately? What values for companies to insist on in their operations?
Well, when I think of values, I think of corporate culture, and there's a Hippocratic oath, obviously, that everybody has to be reminded of, which is essentially, at first, do no harm. Secondly, you have to remember, if you're playing in this industry, whether you're a provider of healthcare or supplier or servicer of it, that there is a patient at the end of the line here that everyone has to keep in mind, has to be cared for, in a dignified and efficient manner. So there's an issue all the time that comes up related to the capitalistic and profit drive that comes into play in healthcare. On a positive note, that creates competition and choice in the market and creativity. On the other hand, there are some elements that are somewhat greedy and take advantage of the situation, which increasingly the federal government is scrutinizing. There's a question mark right now in evaluation of private investors, private equity and venture capital, and the degree to which it's a good idea for them to invest in healthcare providers of care. There's no problem with them investing in vendors of services to the healthcare community, but the providers themselves, there's a question as to whether there's any conflict of interest. And the federal government and the courts are going to sort that out.
What's the key to ensuring that medical providers can focus on improving healthcare for ordinary folks?
Well, they have to stay skilled in their specialty. Providers, doctors, nurses, and other care providers have to be routinely recertified. And that's a nice regulatory standard in order for everyone to remain sharp in their skill sets. They have to decide, whether they want to work in academics or in private healthcare, whether they want to be solo or in group practice. There are pros and cons to all of these things, and those cycles, proceed throughout time, and sometimes it's more beneficial one way than the other, and vice versa. So there's a bit of a pendulum swing that occurs within healthcare with all of these particular dynamics.
What do you see for the future?
Well, for the future, right now, and I hope to see in the future, continued investment in healthcare technologies and services, specifically within artificial intelligence. We're still in the very early stages of the potential. We're very excited about the possibilities. There are opportunities for entrepreneurs and creative folks to solve this current problem that we have, which is the supply and demand issue between the demand of the baby boomers retiring and requiring more care and the more limited resources in the generations behind.
Fewer kids to come in and take the job.
Correct.
So you left one industry and other experiences with Building One. Now you've come into this. What's been the most surprising thing?
I think the most surprising thing is that the culture of the organization matters, regardless of what industry you're in or what kind of institution you're in, whether you're in an investment bank or on a trading floor or in the U.S. military or in healthcare in a doctor's medical private practice or health system. Culture is really important. I've been exposed to some pretty toxic environments, and I've been exposed to some really positive and reinforcing environments. And unfortunately, there's still a big gap.
And your company has, for many years, been touted as being one of the best employers in Northeast Ohio.
Correct.
How do you do that?
In Northeast Ohio and now nationally, we were recognized for the last 2 years in a row. We work on culture very intentionally. We work on our values very intentionally. We hire, we evaluate, and we terminate based on adherence to our company values.
You've been tuned into Forum 360, but before we wrap up, I have one more question for you. And what advice do you have for children who might want to go into this particular line of work?
Well, I think it's an incredible industry, healthcare in general. There's the provider side of providing care, and then there are all the supporting industries. It's a phenomenal future that incorporates the humanity and human aspects as well as technology and innovation. So I think it's got a promising future for our younger generation.
And how would they prepare for such a career?
Study, do well in school, put down your phones in media, and I think that'll prepare you for a career in healthcare.
So one other thing, as you look to the future, what's the next step for you?
For me and our company, we're growing rapidly. We are innovating with new technology and developing an entirely new platform for the the coding and the billing and the electronic health record services that we provide to radiology and interventional specialists. We're not sitting still. And we do believe that these specialties are really critical to the future of healthcare in America. So we're not going to give up.
You've been turned into Forum 360. We've been talking today about the medical crisis of what happens when medical providers are not being compensated quickly and appropriately, and what that crisis is and how to deal with it. Our special guest today has been Harry Curley, who's the president of PRC. And we thank you for coming on to Forum 360 and telling us how to deal with this, how to prevent this crisis, and what can be done for the future with respect to making sure this crisis doesn't happen and people have an opportunity to have the health care that they need and deserve.
My pleasure. Thanks for having me.
Oh, wonderful to have you here. On behalf of Forum 360, I'm Sally Henning.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.